So I was asked to talk today about the social cultural context of elder mistreatment among Native populations, actually here in the United States and in North America, South America in general. I will be talking primarily about elder mistreatment here in the United States, and I will be talking about the cultural context of elder mistreatment, but I wanted to start talking a little bit about prevalence. The primary point I want to make is that there really has never been a prevalent study of this issue here in the United States or in any of these other countries. And there are some reasons for that. One is the great diversity of this population. Just thinking about the United States in general, as you can see here in the slide, there's 566 federally recognized tribes here in the United States alone. There's also many, many other groups that are either state-recognized tribes. There are tribes that are petitioning to be federally recognized tribes. So there's a lot of diversity. There are culture areas that are associated with this. There are many histories that these groups have. So there are culture histories, there are historical histories. Just thinking about carrying out studies alone is a real struggle. Thinking about North America, we have Canada with 633 First Nations, Inuit, Métis, and Northern communities. We have Mexico with over 12 million indigenous groups, and very little literature on elder abuse in these populations. So given that, this presentation will be focusing primarily on the United States. And as you can imagine, it's challenging to make generalizations across these populations. There are a couple of studies that do give us a hint of what the prevalence might be, however. One is a study conducted by Buchwald, and this was a study in an urban primary care clinic. And it basically tells us that 10% of the clientele of that clinic, and these were American Indian, Alaska Native clients or patients, were probably or definitely physically abused. So, and keep in mind that's just physical abuse. So who knows what other kinds of abuse might have been going on with those clients or patients. Another study is a study that I led, funded by the National Institute of Aging, and this is a study called the Shielding American Indian Elders Project. And this study employed a collaborative approach using community experts, working very closely with them to explore cultural understandings of abuse and also to develop a culturally informed assessment of elder mistreatment. And we basically had 100 American Indian elders, 60 years of age and older in our sample, and we wanted to really understand what this phenomenon looked like in both urban and in rural populations. So we worked with urban, metropolitan folks, and then also reservation dwelling American Indians. And so we used a measure, a screening measure, the HS East, which some of you may be familiar with, and we really investigated also the cultural appropriateness of this measure in this population. And then we also developed a new measure that we thought captured the features of mistreatment with American Indians who were living in urban and rural reservation contexts. And we worked pretty intensively with our community experts to try to understand what those might be. And this measure we call the Native Elder Life Scale. So to kind of think about cultural conceptions of abuse, here it's really important to kind of think about the cultural relativity of mistreatment. And of course, as an anthropologist, that's something that I am reckoning with a lot, sort of cultural relativity issues just in general. And so here I've been struggling to think about, what really is mistreatment, and that's something that throughout our meeting we've been, I think, grappling about. What is mistreatment? What is abuse? And so I don't think we can really make assumptions about that. I think it matters a lot So what to one group, is abuse, to another group may not be, and it really does matter. It matters in terms of what people report. It matters in terms of what appears on a prevalence study. And so one example here from the Native population that does come up is that of spiritual abuse. So, here it might be being denied access to ceremonies that a group finds essential or important, being denied access to a traditional healer when one is sick. So that would be an example of a dimension of something that people, this is something people find abusive that in other populations may not be considered abusive. Is that going to appear in a prevalence study? I don't know. So another study that I'm not sure that this one has been maybe this has been brought up at least once in the meeting, I'm not sure, is a study by Hudson and Carlson that looked at perceptions of abuse among different ethnic groups. And it did find that there were similar notions of abuse within these different ethnic groups, but it did find that American Indians classified the greatest number of vignettes. This was a study that proposed different vignettes. Do you see this abuse as abusive? Do you see this as abusive? And it found that American Indians found the greatest number of vignettes as abusive and severe. So I think that also is telling. Do you see this as severe? Do you see this as not severe? That's also important to know when you're thinking about the cultural relativity of abuse. So the Shielding American Indian Elder Project had a quantitative component and a qualitative component. And the qualitative component really focused also on what do you see as being treated well and what do you see as being treated poorly. And these were questions that were directed directly at elders themselves. And the reason for that is we didn't want to just say, what is abuse? That's a loaded question. We wanted to understand more broadly what they saw as good and poor treatment. And we also asked them, though, if they knew of situations where elders were treated badly in their communities, whether they themselves had been treated badly. So we wanted to know that as well. And so here you can see the results of some of the quantitative and qualitative work. What I find interesting is that the elders who participated in the project, that the vast majority of the elders did know of situations where other elders in their community were being treated badly. Many of these cases were things that I think the majority of us in the room would consider abuse. Sometimes very severe abuse, as a matter of fact. So that was not hard to ascertain at all. Also, more than half, when you looked at the quantitative measures, were determined to be at risk for abuse using the screeners. 16% said they had been treated badly by family members. And 7% of the sample were answering questions on the quantitative measures that were sort of flag questions that we felt we needed to investigate in terms of, is this something that could be reportable? Now, it is important to note that we were forced by our institutional review board to tell people 3 times, if you indicate that you have been abused, we are going to have to report this. So probably all of this is underestimate, probably a severe underestimate. So what was good treatment to these elders seemed to be a pretty complex mixture of being taken care of, having one's needs met, and being respected. And poor treatment, financial exploitation, and I will come back to talk about financial exploitation more, neglect, and lack of respect. And people didn't talk that much about physical abuse, although of course it did come up. I can't overestimate the importance of respect in this population, the talk about respect. And on the other side of things, disrespect really seemed to be a huge part of what people thought about when they thought about abuse. So just in terms of the discourse in the qualitative work, respect was very central. And in a lot of Native groups, respect of elders is a kind of a central value. So this really isn't terribly surprising in that sense. Whether it always equates to actual behavior on the ground is another question. Financial exploitation was also huge in the study, both in terms of the quantitative and qualitative data. Certainly, this is not unique to Native communities by any stretch of the imagination, although I think it might play out in some unique ways in Native communities. The discourse that goes on both in this study and then just also in conversations I've had in Native communities is just very ripe. A lot of this is about theft of various kinds, sometimes very low-level theft, but very meaningful in terms of people's ability to survive. The ways it plays out that I think could be somewhat unique in Native communities would be, A, the misuse of housing. So this relates to, for instance, people moving in on people, moving into housing, maybe in an unwanted way, or battering up people's housing, that type of thing, partying in people's housing, that compromising people's housing situation. And then also what I'm calling exploitative child care demands. This could be both of young children, and it certainly is of young children, but also inappropriate demands made by adult children. So that is also a really central part of the discourse that goes on around, I think, financial exploitation. I've included it as part of financial exploitation. Now, the thing that makes this so challenging in Native communities is because there is generally a tradition in many cultural groups of these very close, culturally normative relationships between grandchildren and grandparents that include child care, and they're valued. A lot of times people don't know where to separate out when it becomes exploitative and it becomes a question mark, both in the community and for the elder. And there's guilt, and is this exploitation, and it just becomes a very difficult area for people. That's a difficult thing when you also think about putting that into a study, especially a prevalence study. So, but it's very difficult for people to sort of figure that all out. There's a lot of cultural values around familial interdependence, financial interdependence, people living together in multi-generational housing, in multi-generational setups. That's part of this. And in reservation settings, people are often forced to live because of lack of housing shortages, in overcrowded housing anyway. That kind of gets into the mix. And it makes me think, as I've sat through this meeting, that isolation theory doesn't really fit in that context. To me, that one doesn't make so much sense, because there's certainly plenty of eyes and plenty of people who could be helpful. So that's not really, I think, the theory that I think would explain any kind of elder abuse. So I think, how does financial exploitation relate to pervasive poverty and dislocation that comes along with colonialism is really a huge, huge question here, and post-colonialism. I mean, I think that's a question that should be asked about this population. Another point I really think is essential to make, my observation is the elder abuse that occurs almost always is occurring within a family. This is a family problem. This is a community problem. This is not occurring in isolation. This is not two people. This is a family situation, and often there's a substance abuse problem somewhere in the mix. There's generally a child abuse, domestic violence kind of problem occurring as well. So, and then there may also be a situation where the community is overlooking. I've been told this as I've presented the research to communities. The community may be overlooking it. They know it's going on, but For instance, you've got an elder who's taking care of a grandchild and being neglected at the same time or financially exploited. But the community is overlooking it because they're afraid that the grandchild may be taken away. So, they don't want the grandchild going to foster care. So anything to keep the grandchild from going, or the grandchildren, there probably are many of them, anything to keep the grandchildren from going to foster care, which in Native communities is, there's a long history of that. It's very, very dreaded, and anything to keep that from happening. Many tribes, just to kind of put a little more, context here, many tribes don't have laws focused on elder abuse, and they're sovereign nations, so that's a real issue. There's not laws, so what do we do then? Many tribes have no APS of any kind. Those that do, often is run by volunteers, so yikes, that's another problem. People are often reluctant to involve police, so victims may feel the police or the judicial system can't help them, and that's not just they're making that up. Often the judicial system can't help them. Often in rural or reservation areas, there's too few tribal police to cover the distances involved. It's going to take hours for them to get there. What's the point? In smaller communities, it's often a reality the elder is going to come into contact with the perpetrator or the family of the perpetrator, even if the abuse is reported, so it's going to be a more dangerous situation after reporting. So reporting intensifies the problem. There's the stigma issue, which was mentioned by our previous presenter. You don't want the whole community in your business, and in a smaller community, that's even more of a problem. There's a huge fear of breaking up the family. Fear of losing the grandchildren, that's probably number one. Fear you're going to end up in a nursing home if you have a caregiver who's, in the mix. The elder may be the caregiver for the abuser. So as far as future directions, I do think we need even more work on understanding some of the conceptualization issues around this, especially with the elder and also with the community. Number one, though, where is the breaking point for tolerating mistreatment? What if the elder doesn't think or isn't sure that he or she is being mistreated? And that does happen. So other people might think it, but what if the elder doesn't? So what do you do then? And then also in terms of interventions, you might think that in cases of physical abuse or sexual abuse, oh, that's pretty clear-cut, now we can do something, but often in Native communities there really isn't that much to do, so it's not that clear-cut. And so in some ways it's even more challenging in cases of financial exploitation, like the exploitative child care or the housing misuse, because there's so many question marks about, is it really abuse, or how abusive is it? Does it really cross the line? And is it even worthy of intervention? So I think that those are some of the more immediate directions that need to be gone into before we can even really get deeply into intervention. Thank you.